schizophrenia isn't one thing. It's not one biologic process. Some of it may be genetic, some of it is environmental. And so obviously we can't just have one size fits all medications or treatments. And a lot of our medicines, unfortunately, are what I call final common pathway drugs, D2 blockers. And they're going to do that everywhere. They're not very sophisticated, if you will. And so we're looking at developing medicines that are a little more targeted, whether they're targeted to a circuit rather than the whole illness, but one circuit such as cognition, or whether they're targeted to a subpopulation of people with schizophrenia that have some kind of common neuropathology. And I think that's really where the field is heading. Technology is going to revolutionize what we do. We just don't know how exactly yet, right? But we know from some of the research I'm seeing and some of the studies we're doing at my site, we're using technology now to try to identify subpopulations in the way that we used to hope genetics would work for us. You know, we've been drawing tubes of blood for years, looking at pharmacogenetics, not epidemiology genetics, not looking at something, a gene that predisposes you to schizophrenia and runs in families. That's population genetics. This is there a gene, if I finish a study and I take all the people who responded really well to the drug, is there something they had genetically in common that I could use to predict response and select a drug? That's a lot harder than it sounds with an illness like this that's so heterogeneous. But technology may allow us to see certain circuitry that's involved and help subdivide these patients a little bit.